my name is Sophia Jam. I'm the CEO of Women's Inclusive Team. We've been running since 2003, supporting Black and ethnic minority women in Tower Hamlets. We're a specialist Somali-led women's organisation.
Hi, I'm Kuriza Yasmin. I'm the CEO of Limehouse Project. We've been going for 40 years in Tower Hamlets, and over the last 40 years, we have developed a very strong relationship with the Bangladeshi communities, and we have been supporting them to improve their quality of life. And we joined this partnership in 2023.
Hi, I'm Robin. I'm a coordinator at Praxis Community Projects, a charity that's been based in Tower Hamlets for 40 years, providing immigration advice and campaigning for migrants and refugees' rights. We also joined the project in 2023.
Hi, I'm Vicky Scott. I'm CEO of Tower Hamlets CVS, and we support voluntary and community groups in the borough.
Flourishing Communities addresses the health inequalities experienced by global majority women accessing sexual and reproductive health care in Tower Hamlets. It started in 2022 and has been funded by the National Lottery Community Fund. We have developed health literacy resources with and for Bangladeshi, Somali and migrant women. 5 women gained employment in the GP care group services, held culturally accessible conversations in community languages, produced tools for working with the health system in partnership with GP practices and voluntary sector organisations, developed a closer working relationship between the health system and VCS groups to improve patient outcomes, like maternity drop-in sessions in community settings to break down barriers to access. Women attended the Place-Based Partnership and the Borough's Scrutiny Committee to share their lived experience of maternity services, increased take-up of cervical screening, improved health literacy, reduced health inequalities.
Flourishing Community will be led by 2 steering groups for us, by us.
Continue to design interventions and health literacy.
We continue to have events to educate people.
We will be the voice of the community to influence the change. Really want to build on what already works, bringing services into community spaces. For example, our maternity drop-in sessions. This is a great way of training professionals in a really subtle manner, and it works.
Yeah, and then also training more champions to support community conversations. So around sort of menopause, contraception, in terms of cervical screening. So yeah, hopefully training more champions in different areas.
We influence strategic decision making and bringing women's voice at the center. We're encouraging women to join patients' participatory group, to talk at meetings with GP practices and at public health events as well.
Most importantly, health literacy with communities.
Also health events, more conversations within the communities, and then sort of moving from treatment to prevention.
We'll continue to work in Tower Hamlets, in the community,
in sexual and reproductive health services linked to key stakeholders such as public health, in terms of family hubs, children's centres and many more GPs.
We'll explore parts of the integrated neighbourhood teams, and we will also be working at strategic level with Tower Hamlet GP Care Group, BOTS NHS, Tower Hamlet Together Partnership, and the Integrated Care Board, moving to prevention rather than treatment.
This will really benefit women from underserved communities who've historically been ignored, women who've had their trust completely destroyed, for lack of better words, women who have lost their voice and are trying to find their voices again. That's who we're here for.
And also services when it comes down to like GPs and like maternity services, just making them sort of understand the needs of the community.
You will also benefit commissioners to produce culturally sensitive access to services that are also cost effective.
us, the champions, we are from different backgrounds, so we are able to get into our community and speak to the people we present. So we know the barriers that the people in our community are facing. We know.
I think it's so important when you can relate to the person and the person looks like you, you're more likely to listen to them than some, I don't know, some doctor in the suit or something with a leaflet. It was just us ladies in our abaya or whatever, hijab. We just went to them and said, listen, it's important to get screened. I aware my body and I also awareness like my community, other women. And before, lots of women say, I didn't do the cervical screening. When I presentation my session and end the session, they said, yes, I do. Yes, I will. Yes, I will do. So I feel very satisfied to do this.
Why do we still need this project to continue?
We had enough of people making a decision for us, designing our life how it's going to be. But this time we are getting involved. We are part of the designing. We're part of the planning.
I think that's why we need to keep it going. We're just getting started. I think Tower Hamlets is a big borough.
I wanted to talk about how we're going to use Flourishing Communities to influence strategically at place in Tower Hamlets and work with our strategic partners to understand the needs of the communities in Tower Hamlets. And I think it's a really important time for both Tower Hamlets and North East London as we think about this shift that the health service is trying to do from treatment to prevention. And I think it's projects like Flourishing Communities that really demonstrate what you can achieve and what good co-production really looks like.
We are the right partnership because we work with women in the community who access services in a safe space, such as women's group and health and well-being group.
Where we are partners that are long-standing within the community, therefore become very trusted amongst the individuals in the community.
Having trusted partners takes a long time to develop, and in this process we've made sure that we've had experts from different organisations working together in a way that I haven't seen in the third sector before.
So over the last 3 years, we have extended our connections with not only the health professionals and NHS, we also developed new partnership with places like King's Fund.
We are the right partnership because we connect and represent across the system, both at ICB level, at place level and at neighbourhood level. We're asking the National Lottery for a further £500,000 over 3 years. And that's because Flourishing Communities, whilst it has been hugely successful and really demonstrated the importance of listening to our communities, that it's only just getting started, really, and that we've got so much to cover on with the National Health Service, with the new emerging neighbourhoods ways of working, that we feel that there's a real opportunity here to continue this good work. And we will also spend the time looking for further funding from other partners.